Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans. Welcome back, Chicago, to another episode of Healthy Chicago podcast. I'm your host, Dr. Brian Borah, one of the medical directors at CDPH. Super excited to have my good friend here with me today. This is Star. She is the infectious disease antimicrobial stewardship pharmacist. Yeah. Is that right? At CDPH?
Yeah. A lot of words, I know.
Welcome to the show, Star.
Thank you for having me. I'm so excited. I'm really excited to talk about everything stewardship related and what we kind of do here. So it's going to be fun.
I'm excited to hear a lot more about it. And I'm sorry, I should have introduced you as Dr. Cervantes, right?
Yeah.
So you are a pharmacist, correct?
Yes. Yep.
Okay.
Yeah. So I did, I went to pharmacy school, I did residency training similar to like the physicians do as well. Mm-hmm. Then we can specialize in, whatever we wanted to do, like infectious disease or internal medicine and things like that. And then I worked at the hospital for a couple years, and then I'm here now.
Yeah. How did you make that transition from hospital pharmacy life to public health life?
Yeah, so it's interesting because if you would have asked me, like, do you imagine yourself being in public health, I would have been like, no, probably not. But, the opportunity presented it to itself, and I kind of took it, and it's actually a really great opportunity. I did learn about public health a little bit when I was in school, but not that much. Like, we didn't really know what opportunities were out there, and when I got this position, I was like, well, what am I going to be doing? And it's pretty interesting to see like what we are capable of doing here in the public health sector. So it's pretty fun. I've always liked infectious disease. That's been my personal favorite topic, and antimicrobial stewardship with that as well. So it's been fun implementing that in the city of Chicago. Yeah,
I mean, really cool, I think, to know that we have pharmacists working for the city, working for the health department. Is such a critical role in medicine, but also in public health. And I think, hopefully we can use today to really, explain why that's such a need and such an important role here.
Yeah.
Well, tell us a little bit, you told us really briefly about your pathway to CDPH, but I'd love to hear a little bit about your position and your role at CDPH. Yeah. What does it mean to be the antimicrobial stewardship pharmacist?
Yeah. So like I said earlier, antibiotics were just something that always fascinated me. So when I was younger, it's actually a funny story because my mom, when I would get sick, she would take me to the doctor if I had like a runny nose or sore throat. And I would always get this like pink bubblegum liquid. And that's what I remember. Every childhood, probably every kid remembers this pink bubblegum liquid, which I was like, oh, wow, this tastes so great. How is it medicine? And then I'm just like drinking it and whatever. It makes me feel better. And then it wasn't until I got into pharmacy school, I kept getting this pink bubblegum liquid when I was younger, and I was like, well, what is that? And then I learned that it's actually like an antibiotic, which we call amoxicillin. And I was like, Mom, you've been giving me like amoxicillin, and I probably don't even have an infection. So I went back to her, after learning about it in school, and I was like, that's it. Like, I'm the steward of the household, like no more antibiotics. Like, it's a cultural thing for us. It's kind of like having to teach my parents, like you don't need antibiotics all the time for everything. And that was kind of like a cycle to break. And I'm now like the steward of the house, and my mom will call me and be like, my throat is sore and my head hurts and I have a fever. And I'm like, yeah, you probably have a cold. It's probably doesn't need antibiotics. So that was,
I remember the pink stuff well. And already we've had to give some to our daughters, but hopefully not too much.
Yes.
Right?
Yeah. So, I mean, I love stewardship, and that's kind of what led me here and to this position to kind of, preserve those antibiotics for the future generations that we have, and making sure that we're using them correctly. So part of my job at the city is, for our listeners, just to give some background information. So I am the infectious disease and antimicrobial stewardship pharmacist, and we do have those types of positions in a hospital setting, as well as like physicians as well, that kind of round with the patients and go and see them and prescribe medications and antibiotics, look at regimens and cultures and things like that. So I oversee all of the pharmacists in Chicago in those hospital settings, as well as in the other settings that don't have like a stewardship team or a pharmacist or a provider that's looking at that. So long-term care settings, which include like our skilled nursing facilities, outpatient, which includes like our urgent cares, immediate cares, minute clinics, like things like that, that anywhere where an antibiotic, or I should say antimicrobial, is prescribed, I'm kind of overseeing and helping those programs either start a stewardship program or kind of enhancing whatever they have going on. And it's pretty interesting. I guess I would say like I'm like the steward of Chicago, so making sure we're using antibiotics all appropriately. Yeah, so it's been really fun.
That's really cool. Yeah. Well, let's take a step back for a second because we've thrown around some terms. I just want to make sure we all know what everything means. You mentioned stewardship. You mentioned antimicrobial resistance. Let's break those things down and really talk about what they are and why we care about them so much in public health.
Yeah. So that's antimicrobial resistance, which we call AMR for short.
Okay.
Happens when organisms that are in our body, like bacteria, fungus, viral parasites, will change in a way that make those medicines, like antibiotics, or I should say antimicrobials, because that encompasses all of them, change that make them not work anymore. So our bodies are pretty interesting, and we'll have these organisms that come in, they're exposed to antibiotics, and then they'll basically change either through time or evolution or exposure to antibiotics. And this happens when we're overusing antibiotics or misusing them, and that speeds up the process to that resistance happening. So, for example, if we take an antibiotic and, we have organisms that are left over, those organisms then multiply and they stay in our body, and then they carry that resistance traits or characteristics that will then later either pass on to other organisms or then, can affect the way that medications work in our body. So it's pretty important that, we understand that's how antibiotic resistance happens and how stewardship came into effect. So stewardship is basically taking looking at everything and how everything works and the antibiotics and making sure that we're using them appropriately, making sure that we're not overusing them and following all the guidelines, and to be able to have enough antibiotics to be able to treat these infections later in the future.
Got it. Okay. Yeah. So what you're saying is if there's, a petri dish of a certain bacteria and we introduce an antibiotic to it, we're basically, at some point we're selectively breeding for the pocket, those very small number of bacteria that are resistant to that antibiotic, and then they can multiply, and then they become, more prevalent, and soon enough, those antibiotics are less useful against the infection.
And we get some super bugs out of it too.
Super bugs, yeah. I think that's the term always that's thrown around in the media, right?
Yeah, the super bugs.
The super bugs.
Well, that's how it happens, yeah.
You're like the super bug defender at CDPH.
super bug defender. Or we say antibiotic protector. That's another term.
Cool. So you mentioned you sort of fill this gap, right? So for clinicians, for organizations around the city that don't necessarily have a steward or an antimicrobial stewardship person, you mentioned you sort of fill that gap for them.
Yeah.
Is that right?
Yeah.
Okay. So you must have, pretty good relationships with clinician groups around the city. How do you build those relationships, and why are those so important as well?
Yes, that's a great question. So I feel like this role has really branched me out and networking wise into meeting a lot of great people and a lot of great stewards, like coming from the hospital and knowing some of the ID physicians and, other pharmacists as well. But I'm very fortunate to have, Dr. Black, which is our medical director, and my co-lead in the antimicrobial stewardship program at CDPH, and she has established a platform already since she's been at the health department for such a long time. So I've been able to network and meet with those physicians, and we have a really strong community of clinicians here in Chicago that is really focused on stewardship and being involved, and we're able to communicate with them. And if anything ever, any projects that we have or want to make changes, they're always, up for it and wanting to be involved with us especially. So it's pretty nice to have that, and it's really important to have that kind of relations, as I know a lot of other jurisdictions don't really have that in other public health settings. So it's pretty nice that we have a really cohesive environment here in Chicago.
Yeah. You brought some friends here today.
Yes.
Tell us who these are, what they represent, and maybe we can use these to give some specific examples about, what's been in the news, what is developing resistance, and what are we worried about right now?
Yeah. So I have some friends. So you can see this is influenza.
And for those who are just listening, what are these friends?
These are plushies. They're called giant microbes. It was developed by Drew Oliver, so you can get these online. Usually we hand them out to our staff members. I remember getting them in school too. So we have influenza, which is the flu, and then we have syphilis, which is a little pink guy, looks like a little worm. So these are what the bacteria is actually not actually look like, but a good representation of what they look like in like a physical form. And then we have Pseudomonas, which is this little buggy here. So yeah, super cute to kind of have on here and to remember, what they look like.
And are these entities that in real life are developing resistance? Are we worried about these?
Right. So yeah, so these are an example of just like organisms that, not all of them are currently developing resistance, but could if we are continuing to misuse antibiotics or antimicrobials, I should say, in general.
Right. So let's talk a little bit maybe about what this means for the average person. I mean, antibiotics still have a role, right?
Yeah.
Does this mean that we should stop taking, antivirals and antibiotics completely?
Yeah.
Or how do we approach this topic, as members of the public?
Yeah, that's a good question. I wouldn't say not necessarily to stop taking antibiotics altogether. It's just making sure that we're using them wisely and making sure that we're using them appropriately is the biggest thing. The common thing with patients that I see is they are stopping their medications or they're like starting to feel better. So they're like, I don't have to finish my antibiotic. And that's a common misconception that I've heard a lot when I was working in the pharmacy. And that's something that, as we talked about how resistance happens, if you stop it, you get these leftover organisms that survive and will develop that resistance. So it's really, really important from a public or from a patient perspective to make sure that you're taking your antibiotics as prescribed by your doctor, making sure that you're completing your full treatment dose. So if it says 7 days, take it for 7 days. Making sure that you're not using antibiotics for anything that other than what has been prescribed for you, and that will ensure that you will have the correct treatment dose and you're essentially fighting off your illness as needed. And yeah.
Yeah, so it's what you're saying is not just not taking antimicrobials when they're not indicated, but it's also taking them appropriately when they are indicated, right?
Yep.
I guess another question and something I think about sometimes as a clinician, and maybe you do as well, is from a public health standpoint, we have the benefit oftentimes of knowing about a case of an illness after that diagnosis has already been confirmed, right? So it's easy for us to sometimes, hindsight is 20/20 sometimes. But as a clinician, I think we are often seeing patients, and we don't know what the diagnosis is. We're sort of making an educated guess based on the information that we have. And so, how would you, what advice do you give to, I guess, clinicians who are thinking about the patient in front of them and not necessarily the whole population?
Yeah.
And, understandably, often I think err on the side of, well, I don't know if this is an infection, but I want to be safe just in case it is, right?
Yeah, that's a great point. So I would suggest, using the guidelines and policies that we have that are available. I mean, there's numerous amount of information and data out there on how to treat specific infections that everybody's aware of. There's a lot of great resources. When you have that patient, I know we've talked about, in urgent care settings, we've seen that, patients come in and they're, presenting with symptoms, but they don't quite fit, all the criteria that checks off the boxes that our guidelines say, but there are a lot of tests. So the issue is that, do you treat or do you not treat?
Yeah.
And there's been a lot of good practices where it's like, okay, if for kids, for example, if the ear infection is, persistent and it keeps happening and you don't see an improvement in a couple of days without taking antibiotic, then maybe you should, get an antibiotic at a certain point in time. But it's also like for people who are like, well, my nose is runny and my throat is sore and, it could be a cold, then not necessarily you don't need an antibiotic. So that's kind of like the weighing in and weighing out. There's also, physicians can use susceptibility patterns, which is looking at the organisms as a whole in like a general population and seeing like what antibiotics are okay to use and which ones are not. So which ones are resistant and which ones are susceptible is what we call it. And tailoring their algorithm or guidelines or whatever they have to those specific ones. So making sure that you're using one that's going to be appropriate for most of the time.
That's interesting. Now, are there regional or geographic differences in I guess, resistance patterns? So, I mean, here in Chicago, could one bug be resistant to an antibiotic that in New York City, they don't necessarily have that problem.
Yeah, definitely. And that goes back to like how resistance happens. So organisms can pass that resistance on to other organisms. And this is like spread all over the world. Like it's not just here in Chicago. So you can have cases of resistant organisms here in Chicago that you won't have in other states and things like that, and even so within Chicago. So if we have multiple organisms, like a group of people that are living, like let's say in like a facility that have commonly resistant organisms, they can pass them on easily by having poor hand hygiene and things like that, versus like in other parts of Chicago or like the south of Chicago where you won't really see that because those patients are like up in a different location. So it's very interesting to kind of see how those changes happen. It's pretty different to see it like how it is from in Chicago with the rest of like Illinois itself as well, in like those more rural areas where people may not have access to healthcare as easily as we do here in Chicago.
Interesting. I wonder if you can tell us a little bit about specific projects or interventions that the health department has done or is doing to combat some of this.
So we kind of tailor it to the couple different settings. I know I talked about earlier with like long-term care, urgent care, outpatient, and acute care. So we've done a lot of work with the acute care side, which is our hospitals in Chicago. So we have done like specific tools like an ICAR, which stands for like an infection control and assessment response tool. And this measures how well or how a program is doing in their stewardship side of things. And we look at like policies, guidelines. We offer any resources or any help and make sure that they're meeting the requirements for Joint Commission, which is like our regulatory people that come down, and CMS, which is Medicare, and things like that. And we've also hosted work groups. So that was something new that I just started last year, where we can all kind of meet virtually right now and talk about like ideas and what needs help and who needs help and how others can help, and kind of fostering those collaborations and just networking and being able to bounce ideas off of each other. So it's been really cool to see that and have that started here in Chicago.
Are you going into hospitals and meeting people and really like assessing on the ground their practices?
Not right now, since stewardship is a lot more of kind of like policy and guideline based, but we would want to do that eventually once we are like incorporating more of these ICARs in other facilities. So we haven't done a lot of outreach yet, but we're hoping people will open the door for us to come in and see. I mean, we are obviously non-regulatory, like we don't have any punitive, like it's all just help. Like we're here to help is the key.
Got it. Okay. And I guess beyond even the city of Chicago, what are the biggest challenges you see within this field of public health or field of medicine? Are there bigger topics and sort of bigger threats on the horizon that we need to prepare for right now?
Yeah, I feel like the biggest thing is just awareness. Like there are bigger, multi-drug resistant organisms where there's organisms that are resistant to not just one drug but multiple drugs, which can cause some concern. And this goes back to all the resistance that we talked about earlier. And stewardship plays a big role in kind of trying to minimizing and preventing those from getting any bigger. Pharmaceutical companies are making new medications that can help with these types of infections as well, but it's all about spreading awareness. Like we are very, if somebody doesn't know what resistance or how stewardship works, and that kind of sets it in place for us to be there and providing that education, whether it's to our healthcare providers who should know and be able to implement that in their settings, but to our patients as well. Like the healthcare providers, there's a lot of great resources on CDC that they can have that will educate patients and show like pamphlets and things like that of like when you use antibiotics and when you don't, and how you should use them, and what's the difference between a cold and the flu, and like how do you use that in those types of settings. So yeah, I feel like education and awareness is like a big thing. So every year we have U.S. Antibiotic Awareness Week that is hosted in November, and that's something that's big throughout all of the country. CDC throws like this big, Twitter storm and IG storm and Facebook storm that we're just like sending like blast information about antibiotic awareness and antimicrobial resistance and things like that. So I feel like keeping a lookout out on for those and getting informed and just kind of like making yourself aware of what's happening and your family members too, because I know my family didn't really understand what that meant. So
yeah, and I think, on the one hand, it easier to understand a single organism or an entity developing resistance in response to an antibiotic, right? But I think what is most alarming is when you back up and you think that, there was a time where we didn't have antibiotics, we didn't have antimicrobials, and when someone had an infection, oftentimes they got very sick or they died, right? I mean, and I think it's so easy to take these medications for granted now. And the risk, of course, is that we lose the ability to use many, if not, most of the antibiotics and antimicrobials that we have, sort of in our arsenal right now, right? Yeah. Are there, are scientists working against this? Are there new antimicrobials being produced? Are there things going on sort of the national or international level to combat this as well?
Yeah, I feel like there's constantly like new drugs that are coming out. I wouldn't say as frequently as we would hope for, but there are a lot of, medications and antibiotics that they're looking at that, weren't approved at a certain point of time that are now like being reevaluated and being approved for infections now that we didn't have before. So it's pretty interesting to kind of see all those pipeline drugs is what we call them that are like being in the works and kind of making those we're running out of options right now. So it's kind of making new ones as we go and getting them to be able to have, I guess, financial funding to be able to support those like research projects and things like that.
Right.
Yeah.
I mean, developing some of these drugs is not an easy process.
Or cheap,
right?
Yeah.
It takes years, if not decades, and a lot of oftentimes failed trials to arrive at something that works.
Yeah, or we'll have like a combination of like medications being used. So we have like an older drug that we haven't really used in a long time being used with a newer agent that we've seen in some of our organisms as well. And that's pretty interesting, like a combination of both. Yeah.
Any goals, any interesting things on the horizon for you at CDPH? Are you developing any interventions or efforts or anything you want to shout out?
Yeah, we're looking into getting into that long-term care and outpatient setting. That's been kind of something that we've been trying to target. We've noticed that our outpatient providers have a little bit more of less, I guess, support for antimicrobial stewardship. So that's something that we really want to learn more about in those fields and kind of what they're doing and how we can help them and just being a resource to seeing, what opportunities that they have and getting their C-suites to, help start those programs at their facilities. And because if you think about it, that's the first place that a person usually goes to when they have any type of illness or anything. You go to the urgent care or you go to the immediate care and you see the providers there, and usually they're like advanced practitioner providers, so like a nurse practitioner or a physician assistant that is seeing you, and that's the first time that you're going to be prescribed something if you are like supposed to be prescribed something. So we've seen a lot of trends where there's been over prescribing of antibiotics in those specific settings, and we'd want to look more into seeing like why that's happening.
Fascinating. Well, thanks again for all the work you do for CDPH.
Of course.
Hopefully we can have you again on the show soon.
Before
sure. You go, though, we are in basically the middle of summer. I think, sadly, probably crossed over into the second half of summer already.
It's been fast.
What's something you've done, maybe in the last week or something local you've done here in Chicago or in your neighborhood?
It's been pretty busy summer. We've had a lot going on, but we've gone to a lot of baseball games. So
nice. MLB games?
Yes. So we are White Sox fans. I am a South Side girl, born and raised. So we've gone to a lot of games this summer. So that's been pretty fun. We usually host like our annual baseball game with my family, and that was just a couple weekends ago.
Great.
Yeah.
Great. Well, Dr. Cervantes, thanks again for being here.
Thanks.
Hope to have you again soon. Thanks to all of our listeners for tuning in, and we will see you soon. And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Borah, and we'll see you next time.